Thank you, Joe, for introducing us to the signs and symptoms of laryngeal paralysis in a Labrador Retriever dog breed. My name is Tyler Rogers, and I'd like to take a few minutes and tell you about the care and treatment for this disorder. I'd like to first reiterate that laryngeal paralysis is a disorder in which the nerves that control the muscles and cartilage that open and close the larynx or voice box do not function properly, causing voice changes and difficulty with eating or breathing. As Joe has stated, this can be dangerous for the dog and even lead to death. Please, as a dog owner, and especially as a lab owner, be on the lookout for these signs and symptoms. As far as care and treatment is concerned, in most cases, surgery is needed. The most common type of surgery for this condition is a procedure called arteroid lateralization, sometimes also known as a laryngeal tieback surgery. This involves putting one or more permanent sutures in place to hold the arytenoid cartilage open so that adequate air can pass through. Most dogs do quite well after this surgery, although there is a small risk of bleeding during the surgery, inhalation of stomach contents during the surgery, or aspiration of food and water after the surgery. The surgery is usually only done on one side, which provides increased airflow and less risk of aspiration. This procedure will permanently leave the larynx open. As such, the following at-home steps need to be adhered to. Strict rest for 2 months to allow healing of scar tissue, soft foods such as meatballs for 2 weeks, minimum water intake, painkiller for 7 days, permanent metoclopramide, a gastric and esophageal drug for life, weight loss and weight control as needed, as a large percentage of these dogs are overweight, contributing to this disorder. And over the long term, it is recommended using a harness instead of a neck collar. The only restriction after this procedure is swimming. Your dog will have a permanent open larynx with no possibility of closing it off should he or she swallow water. There is therefore a risk of aspiration at best and drowning at worst. We'd like to thank you for your participation in this consultation and overview of laryngeal paralysis, and Joe and I hope that you take this material to heart. Thank you.